Welcome to Mindful Objective. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today we're tackling a simple but often confusing question. What is integrative health? People hear that phrase and think it's just another form of conventional medicine, or maybe they assume it's something mystical or alternative. Neither is true. Integrative health's about connecting the dots. Your body, your mind, your daily habits, and even your environment to help you live healthier. But before we dive in, I want to be clear. I don't practice medicine. I'm not here to diagnose, treat, or cure any diseases. As integrative health practitioner, we provide health coaching, education, and guidance through integrative health. We look at the whole picture and support your body's natural ability to heal. We also weave in approaches like Ayurveda, a traditional system of health from India that focuses on balance and prevention, so that our work isn't just about supplements or lab tests, but also about living well. As always, this show's for educational purposes only. We do not diagnose, treat, or cure any illness or disease. And by the end of this podcast, this episode, you know exactly what integrative health is, how it's different from conventional care, and why it might be the missing piece you've been searching for. So when most people hear the phrase integrative health, they don't know what to picture. Some think it's yoga, meditation, and even essential oils. Others assume it's alternative medicine, something you only try when nothing else works. And still others think that it's just another name for conventional healthcare. The reality is integrative health sits in its own lane. It's not about rejecting medicine. It's not about mystical quick fixes. It's about seeing you as a whole person and bringing together the best tools from both modern science and ancient wisdom. Holistic health is great. And here's the simplest way to put it. Integrative health looks at the whole body and asks why problems are happening in the first place. Conventional medicine often focuses on what is wrong, like high blood pressure, bloating, or fatigue, and then treats the symptom. Integrative health asks, why is this even happening? And what can we do to bring the body back into balance? Let's take a real world example. Say someone has digestive discomfort after meals. In a conventional setting, they might get a quick exam, maybe a prescription for antacid, and then maybe sent home. The symptom might calm down for a while, but the reason for discomfort remains. In integrative health, we ask the bigger questions. What foods are you eating? How fast are you eating them? Do you have food sensitivities? Could stress be playing a role? What's happening in your gut microbiome? So at Mindful Objective, we dig deeper by combining modern tools and coaching. That might mean running functional lab tests like a stool test to check digestion or food sensitivity panel to uncover what's really going on. Then we build a plan with you, step by step. Maybe it includes removing triggering foods, adding gut supportive supplements, adjusting meal timing, or weaving in practices like Ayurveda, like mindful eating and seasonal food choices. It's not a band-aid fix. It's a personalized system to help your body heal and function better. Another important piece is that integrative health values prevention. Instead of waiting for a crisis, it looks for patterns and early signals. Maybe your labs are still in the normal range, but you're exhausted, irritable, or sleeping poorly. That doesn't mean nothing's wrong. It means your body is whispering before it starts shouting. By addressing those whispers now, we can prevent bigger issues later on. This is also why we stress at Mindful Objective, we do not practice medicine. We're not here to diagnose or replace your doctor. What we do is coaching and guidance. We help you understand your body. We use labs to inform your personalized plans, and we support you in making realistic, lasting changes. Many of our clients work with both us and their medical doctor. It's not either or. We work together. And then there's the role of Ayurveda. Ayurveda, which is thousands of years old, it's all about balance. It teaches you that your daily rhythms, digestion, and lifestyle are out of sync. You'll feel unwell. Modern science is proving this true. Circadian rhythm, gut health, and nutrition all play huge roles in long-term health. By weaving Ayurveda into integrative health, we're not stepping away from science. We're adding another layer of wisdom that makes care more personalized. Again, to you. So if you're wondering what is integrative health, here's the bottom line. It's a whole person, root cause, prevention focused approach that uses both modern tools and traditional wisdom. Here at Mindful Objective, that means functional labs, supplement protocols, health coaching, and also Ayurveda practices that are tailored to your unique needs. Again, specifically to you. Integrative health doesn't see you as a condition. It sees you as a human being whose mind, body, and environment are connected. And when we connect the dots, that's when real healing begins. So one of the most common questions I hear is, so how is integrative health different from what my doctor already does? And that is a fair question. On the surface, they might look similar. We both talk about nutrition, lifestyle, and health goals. But when you take a closer look, the mindset, the tools, and even the goals are very different. Conventional medicine is one of the greatest achievements in our modern world, that's for sure. If you break your arm, need surgery, or dealing with a life threatening infection, there's no better system to save your life. Doctors and nurses are trained to act fast, use technology, and provide treatments that can stabilize and reverse emergencies. We're all lucky to be alive in a time when conventional medicine exists. Think living 500 years ago. Man, that would have been a nightmare. But here's the truth: conventional medicine is primarily reactive. It's designed to step in after something has gone wrong. You usually see your doctor when symptoms are severe enough to get you attention. And because the system is built around diagnosing and prescribing, the solution often ends up being a medication or a procedure. That approach is valuable, but when it's needed. But it doesn't always get to the root cause. Integrative health, on the other hand, is proactive. Instead of waiting until your body's in crisis, we look at the early sign that something's off. We ask, why is the problem showing up in the first place? And then we work with you to restore balance before issues actually grow. Let me give you an example. Imagine someone with recurring migraines, right? Someone like me. In a conventional setting, the focus might be on prescribing a pain medication or a drug to reduce frequency of headaches. That might help in the short term, but it doesn't explain why the migraines are happening. In integrative health, we explore nutrition, hydration, sleep quality, stress management, hormone balance, and even your gut health. We might run functional labs to check nutrient levels or food sensitivities, and from there, we build a plan that addresses your triggers and supports your body naturally. Another key difference is time and personalization. In most doctor offices, you might get 10 to 15 minutes with your provider. That's not enough time to talk about your sleep, your stress, your digestion, your daily habits, or your health history. In Mindful Objective, we take the time to understand the full picture. Sometimes I do talk too much, so sorry for that. We don't ever hand out a one-size-fits-all advice, right? Every person has a unique story, and that story matters. That's where coaching comes in. We don't just tell you what to do. We walk with you as you do it. Let's say your doctor tells you to lower cholesterol. That's important advice, but you leave asking, now what? What do I eat? How does this fit into my life? Here at Mindful Objective, we help you create a plan that works with your schedule, your preferences, and your goals. Maybe that means teaching you how to prepare heart healthy meals using functional labs to check inflammation markers and supporting you with supplements that fill that nutrient gap. It's also worth noting that integrative health doesn't reject conventional care. In fact, we often work alongside these medical doctors. If someone has thyroid issues, for example, we may encourage them to stay with their prescribed medication while we explore gut health or stress reduction or nutrient support. The two approaches complement each other. And then we have Ayurveda. Conventional medicine doesn't usually take daily rhythms, seasonal eating, or body constitution into account, but Ayurveda does. When you combine that ancient wisdom with modern science, you get a more complete picture of what the body needs. For instance, conventional medicine might suggest fiber for digestion, while Ayurveda might recommend warm, cooked foods at regular times of the day. Together, those two approaches often work better than just one alone. So here's the bottom line. Conventional medicine saves lives when there's a crisis. Integrative health builds health before a crisis happens. And at Mindful Objective, we focus on prevention, personalization, and root cause care with functional labs, supplements, Ayurveda practices, and step-by-step coaching. We're not here to replace your doctor. We're here to fill those gaps and give you the tools that conventional care often doesn't have time or structure to provide. When people ask, what's the difference? I usually say this. Conventional medicine asks, what's wrong and how do we fix it? Integrative health asks, why is this happening? And how do we bring the whole body back into balance? But you see, both are important, but they're very different ways of thinking about our health. And one of the most powerful parts of integrative health, and something that often surprises people, is the role of coaching. A lot of people come to us expecting a model that looks like a doctor's office. They think we'll take their symptoms, make a diagnosis, and hand them a treatment plan. But that's not what integrative health is about. It's definitely not what we do at Mindful Objective. Instead, we focus on coaching, guidance, and that education. Think of it like having someone walk beside you step by step and build healthier habits and make changes that last. Coaching is what brings the gap between knowing what you should do and actually being able to do it. Let's be honest, most people already know some of the basics. They know eating vegetables is healthier than eating fast food. They know they should sleep more, drink water, and exercise regularly, but knowing doesn't always translate into action. Why? Because life gets in the way. Work is busy, stress is high, family obligations leave little time for yourself. But that's where coaching matters. And at Mindful Objective, coaching starts with listening. We want to understand your story, your challenges, and your goals. Maybe you're struggling with fatigue, or you want to lose weight, or you're dealing with daily digestive discomfort. Once we know your story, we use these tools like functional lab testing to see what's actually happening beneath the surface. From there, we design a plan that's specific to you. But the real difference is how we implement it. We don't just hand you a packet of information and send you off on your own. We walk with you. If we decide together that the mornings need more protein, we talk about how to fit that into your routine. If stress is keeping you up at night, we look at realistic relaxation strategies. Just meditate for an hour, but things that actually stick with you. Another piece of the coaching puzzle is accountability. Change is hard when no one's checking in on you, but when you know we're here to have a follow-up, you're more likely to stay consistent. And when setbacks happen, and they always do, we help you adjust instead of quitting. Maybe you travel for work or fall back in old habits. Instead of beating yourself up, we strategize together on how to do better next time. Remember, it's not about perfection. It's about making positive changes. And remember, education is just another pillar in what we do. We don't just say, take this supplement. We explain why your body may need it, how it supports your system, and what results you can't expect. For example, if your labs show low magnesium, we'll talk about magnesium effects on your sleep, your stress levels, and even your digestion. When you understand the why, the changes make sense, and you'll be more motivated to follow through. This is also where we weave in Ayurveda. Coaching isn't just about food and supplements, it's about lifestyle. Ayurveda gives us that simple, practical ways to bring balance into daily routines. Maybe it's encouraging you to eat your largest meal at midday when digestion is strongest. Maybe it's helping you design an evening wind-down routine to calm your nervous system. These aren't overwhelming tasks. They're small, manageable changes that add up. But remember, all of these things are specific to you. So there's people that don't eat a lot of protein in the morning. There's people that get up earlier than others. There's people that work out first thing in the morning. There's people that fast most of the day. So how do you take these supplements? So that's why that one-size-fits-all approach does not fit. And that's where every individualized plan is specific to the person. In Mindful Objective, the combination of functional lab, supplements, Ayurveda, and coaching creates something powerful. A personalized path forward. Again, no two people have the same plan and no two people live the same life. One client may need more stress support, another may need gut health healing. Another may simply want more energy for playing with their kids. Coaching allows us to adapt to your needs, not force you in a one-size-fits-all solution, which you get often in conventional medicine. You bump your knee and your doctor usually says the same thing they say to every other patient. Take this, do this. Same, stomach issues, maybe they all say, you know what, take this antacid or go see a specialist. The same wording, the same thing. So they just go based on symptoms and treat that symptom, right? But again, that's not what we do. And the truth is, most people don't fail because of the lack of information. They fail because of the lack of support. Coaching gives you that support. It gives you someone in your corner who believes in your ability to change, helps you problem solve when things get hard, and keeps you moving forward when life throws challenges at you. My different clients know and friends know when it comes to the subject, I love to talk. Sometimes I talk a little too much and go over my time limits, my own time limits, but it's a passion of mine, right? I know there's a lot of things out there that people do not know when it comes to integrative health. And that's what excites me, right? That excites me to do these podcasts. It excites me to meet with different people and kind of explain different things that they didn't know about, especially when they come from that side of just listening to a medical doctor. So there's so much to explain when it comes to this and fill in that gap of information on, hey, you know what? Did you look at this? Did you do this? And a lot of people do not know any of this exists. So if you ever feel stuck, like you know what to do, but can't seem to do it, remember, coaching may be that missing piece. And that's exactly what we focus on at Mindful Objective, helping you not just know what to do, but actually make it reality in your life. And on to when we talk about Ayurveda stuff, when people first hear the word Ayurveda, many don't even know what to think about that word. Some assume it's spiritual or mystical practices also. Others imagine complicated rituals that don't fit into modern life. But the truth is, Ayurveda is one of the oldest systems in the health in the world, and its wisdom is incredibly practical, even today. Mindful Objective, we use Ayurveda as one of our guiding frameworks because it brings in balance, personalization, and timeless insights into integrative health. So let's talk about what exactly is Ayurveda. The word itself means the science of life. It originated in India over 3,000 years ago and been passed down through generations. Unlike conventional medicine, which often focuses on treating illness once it shows up, Ayurveda emphasizes prevention and balance. It teaches you that when your body, mind, and daily routines are aligned, health flourishes. When they're out of balance, symptoms appear. And you may see this a lot if you go to a chiropractor. They strongly believe in Ayurveda. And one of the most useful aspects of Ayurveda is the idea of doshas, or body constitutions. There's three main doshas, Vata, Pitta, and Kapha, and each person is a unique combination of them. For example, someone with a dominant Vata constitution might naturally be energetic, creative, fast-moving, but also more prone to anxiety, dryness, and digestive irregularities. Someone with more Pitta type might be more sharp, focused, and driven, and may also deal with inflammation, heartburn, and irritability. And the Kapha type might be calm, steady, and nurturing, but could struggle with sluggishness and weight gain, even if it's out of balance. Now, why does this matter? Because it means health recommendations aren't one size fits all. What your body works for your neighbor might not work for you. Ayurveda personalizes health in a way that surprisingly is modern. For example, modern nutrition might recommend eating raw salads for everyone because they're high in nutrients. Ayurveda would say raw salads might be great for someone with strong digestion. But someone with a weaker digestive fire, cooked vegetables might actually work better. And science today confirms this. People with digestive issues often do better with warm, cooked meals. Another area Ayurveda shines is daily routines. This includes waking up with the sun, eating meals at regular times, and creating evening rituals for better sleep. Modern research now shows the importance of circadian rhythm for hormones, metabolism, and even your mental health. Ayurveda was teaching that, thousands of years ago. So remember, at Mindful Objective, we often incorporate Ayurveda into coaching in small, accessible ways. For example, if a client has trouble sleeping, instead of just recommended melatonin, we may encourage Ayurveda-inspired evening routine. Turning off screens an hour before bed, sipping a warm herbal tea, practicing deep breathing, and being in bed by 10 p.m. If someone struggles with sluggish digestion, we may suggest adding digestive spices like ginger or cumin with your meal, drinking warm water instead of ice cold, and eating the best and biggest meal at midday when digestive is strong. Ayurveda also emphasizes seasonal living. In the winter, heavier, warmer foods may help the body be balanced. In the summer, lighter, cooling foods prevent overheating. Today, nutrition science supports the idea that seasonal eating is beneficial. It improves nutrient diversity, supports digestive gut health, and helps regulate your immune system. What's powerful about Ayurveda is how it integrates with functional labs and modern approaches. For example, if someone's labs show high stress hormones, we might use herbs like ashwagandha, which Ayurveda has been used for centuries. In clients, if their digestion's off, we may combine probiotics and targeted supplements with Ayurvedic food recommendations. The combination of ancient wisdom and modern testing makes the plan stronger and more personalized. A lot of clients at Mindful Objective tell us that Ayurveda feels like the missing piece. It explains why they struggled with certain issues and gives them practical tools they could use daily. It shifts the mindset from fixing a problem to living balance. That shift alone can transform the way you think about your health. So when we say integrative health at Mindful Objective, we mean literally. We integrate modern science, functional labs, supplements, and health coaching with ancient wisdom of Ayurveda. Today, they create the system that respects both from where we come from and where we are today. Ayurveda may be thousands of years old, but its lessons are timeless. Balance your digestion, honor your body's rhythms, personalize your routines, and health will flow. It will follow. And when you combine that with today's science, what do you get? You get a complete picture of your health that's practical, sustainable, and deeply effective. So we did talk about definitions, differences, coaching, and Ayurveda, right? But in the end of the day, people want to know, what does integrative health actually look like when you're working with somebody? It's one thing to understand the theory. It's another thing to see how it plays out in your daily life. So let's paint you a picture. At Mindful Objective, the process usually begins with listening. We want to hear your story, your symptoms, your goals, and even small details about your daily routine. Many clients come in saying, I'm not sick, but I don't feel great. Or my doctor says my labs are fine, but I know something's off. And that's the sweet spot here in integrative health. And this is where it can make a huge difference. From there, we often use functional labs, right? These aren't the same standard labs you might get from your doctor's office. As any of our new clients, they see these labs and never knew they existed and can't believe how much details are within these labs. They're more detailed and they're designed to uncover imbalances that aren't always obvious. For For example, we might run organic acid tests to see nutrient levels and gut health markers. We might use a food sensitivity test to check for hidden triggers or inflammation. We might order a hormone panel to understand why you're tired or not sleeping well. These labs give us deeper insight onto what's really happening in your body. Once we have that information, we build a plan. But here's the key. It's not a generic plan. It's personalized to you. Two people might struggle with fatigue, but both causes can be very different. One person may be low on iron, another might have thyroid imbalance, and another may have poor sleep quality and stress. Their plans won't look the same. Here's an example. Imagine someone who struggles with afternoon crashes. Conventional medicine might say grab a cup of coffee or take a nap. In Integrative Health, we're going to look deeper. Maybe labs show blood sugar imbalances. In that case, we guide them towards meals with protein and healthy fats. We'll teach them to avoid sugar spikes and possibly use supplements like chromium or magnesium to support that balance. We'll also look at that lifestyle. Are you staying hydrated, managing stress, getting quality sleep? Together, those changes could eliminate crashes completely. Or take digestion. A client comes in with constant bloating. Instead of just handing out an antacid, we might use a stool test to see what's going on. Maybe it's, low digestive enzymes. Maybe it reveals bacteria imbalances. From there, we create a plan that can include enzyme support, probiotics, Ayurveda tips like eating warm cooked meals and slowing down your eating. Are you eating too fast? The bloating doesn't just disappear with the pill. It goes away because we address the root cause. The goal of integrative health is identifying that root cause, not conventional medicine. Another area where integrative health shines is stress and energy. Many clients feel burned out. Instead of just telling them to relax, we provide actual strategies that might include guided breathing exercises, magnesium supplementation, or again, those Ayurvedic adaptogens like ashwagandha to support resilience. We also look at routines. Are they pushing their bodies at night when rest is needed? Are you working out at night? Are you doing too stressful workouts during the day? Are they getting morning sunlight to reset circadian rhythm? Small adjustments in these areas completely shift energy levels and your mood. So what's unique at Mindful Objective is that we combine all of this with coaching and accountability. It's not about just giving you a supplement plan and handing over supplement and lab results. It's about teaching you why these steps matter, helping you fit them into your real life and adjusting as you go. If something doesn't work, we pivot. If you hit a roadblock, we problem solve together. That's the difference between temporary improvement and lasting change. Clients often tell us that this process feels different from anything they tried before. It's not rushed. It's not a one-size-fits-all approach. It's not just treating the symptom. It's about feeling truly seen and understood. Many times people leave saying, this is the first time someone has actually really connected all the dots for me. That's where integrative health looks like. It's also worth pointing out that you do not need to wait to be sick to start. Some of our most successful clients came in simply wanting to feel better. More energy, improved sleep, fewer cravings, and weight finally started moving in the right direction. Integrative health isn't only for people in crisis. It's for anyone who wants to optimize how they feel and perform each day. So in real life, integrative health looks like this. Personal lab testing, food and supplement plans tailored to you, Ayurvedic routines that restore balance, coaching for accountability, and ongoing support so you're never left on your own. It looks like creating health, not just managing a disease. And at Mindful Objective, that's our mission, to help you take charge of your health journey with tools that last a lifetime. So as we close out today's episode, let's circle back on the big question. What is integrative health? It's not one tool, one supplement, or a routine. It's a way of looking at your body as a whole and asking not just what's wrong, but why is it happening and how to bring back balance. At Mindful Objective, we do not practice medicine. I want to be clear about that. We do not diagnose, treat, or cure disease. What we do is health coaching, education, and personalized support. We use functional labs to uncover hidden imbalances, supplements to fill nutrient gaps, and Ayurvedic wisdom to restore rhythm and balance. And we wrap all this up with coaching, so you're never on this journey alone. The goal is empowerment. Instead of being a passive patient, you become an active participant in your own health. You learn how your body works. You gain tools to make your life make sense. You build habits that last long after our time together. And the best part, you don't have to wait for that crisis to start. Integrative health is for anyone who wants to feel better, sleep deeper, think clearer, and prevent future problems before they take hold in that body. If you're curious what this looked like for you, visit mindfulobjective.com. Explore our functional lab, supplement store, or even our coaching programs. Take it one step further of your future self. You'll thank yourself for it. As always, the reminder this podcast for educational purposes only. It's not intended to diagnose, treat, cure, prevent any illness or disease. Always consult with your licensed healthcare provider before making any changes to your health routine. Until next time, stay mindful, stay curious, and keep moving forward in your health journey. Stay well.